Welcome everyone to Urban Health Podcast. Today we are in conversation with Dr. Amrita Godbole. She's a senior practicing gynecologist at Shri Hospital and Maternity Home at Vasna. Welcome. And today we also have Dr. Aishwarya Nair with us. Hello. So today we are going to talk about most asked question to a professional.
Yeah.
Like today is like me as a layman, me as like a very millennial female. I first Google
up.
I Google up my symptoms.
That is the first resort.
That's the first
resort.
And you know, for some reason, you are very afraid to go to the doctor, or maybe you're lazy to go to the doctor.
No. Sometimes it is too intimate or something which people can't easily share. It is their personal life, and people are now believing in more of their personal space. And I want my space and my life, so they do not want to talk or share any of their intimate things to any other person, even their own parent for that matter. So they would like to find out their solutions on their own. So Google Baba is the best.
I wanted to ask that, like in your practice of 3 decades, so how have things changed? How have people come? Like when I was working, people used to come, "Okay, madam, there go balls." Like, they're not saying, "Okay, what symptom? Do you have some pain? What are the symptoms? Like, तुमको कैसे पता तुमको balls? Google ने बोल दिया.
Yeah, they do come. Like for me, the most common, like for a woman, it would be a white discharge. Suppose the most common symptoms patient come with itching or burning and white discharge.
Right.
So they'll say, "Madam, मेरे को urinary tract infection है, आप मुझे दवा दे दो." मैंने बोला, आपको कैसे मालूम? आपने यूरिन टेस्ट कर लिया? नहीं, इन्फेक्शन है बोला है. किसने बोला? तो पता है. So then you should understand that it is Google Baba के आशीर्वाद से ऐसा सब हो रहा है.
Contraception, I guess. There are a lot of myths about contraception.
What is the most common myth?
Like
you have met?
on the go pill, like morning after pill.
Yeah.
72 hours.
72 hours, and you have so many slangs.
This 72 hours.
I don't even understand what to.
Okay, so.
कब लेना है? 72 hours के बाद लेना है?
No. सभी कुछ instructions दिए हुए थे. With the pill, you get a set of instructions, and fortunately in India there are in many languages too.
Okay.
Suppose you get the information. In India. So it will be in even Kannada, Tamil. Suppose you have a Maladi tablet. You have got the instructions written in, I think, about 4 or 5 maximum spoken languages in India.
Okay.
It has been given. हिंदी में दिया जाता है, मराठी में दिया जाता है, इंग्लिश में दिया जाता है, और I don't know the means. I think it's Malayalam or Tamil. I don't know. You know those letters. Kannada में है. So you get all the instructions. You have to just read them. Now emergency pill. What is that? 72 on the go, whatever. So those pills are not should not be the norm.
What happens if we miss the periods? Like it's a very normal thing that sometimes I guess missing the period has been taken like a very you miss one cycle.
Had a normal cycle, and one month she skipped it. So
Just skipped it.
choosing answer.
In a reproductive age group, when they're in reproductive, if you miss a period, you first check up whether there is any chance of pregnancy or whether you're pregnant or not. If you're not pregnant, and if it is just a by chance, wait for at least 10 or 15 days beyond the date to get your normal periods.
Okay.
And if you don't, then please do consult a doctor.
So everyone's talking about HPV. So how they're comparing it to HIV. So is it as dangerous, or is there a cure, or what is about HPV?
There is a prevention. And,
no cure for the virus as such.
Yeah, there is none.
Virus, yes.
See, any viral infection is a self-limiting thing.
Right.
The virus,
Self-limiting, does it require any treatment?
Okay.
कोई भी viral flu आ गया, या as we have exposed recently seen coronavirus.
Yes.
So no matter of whatever treatment is just a life-sustaining measures. There are no antiviral. Suppose there is recurrent infections, change of sexual partner, unprotected sexual intercourse, lots of childbirth. Like many childbirths, means that is giving trauma to the cervix. Okay, cervix is the गर्भाशय का मुख को cervix बोलते हैं. So उसको बहुत trauma हो जाता है. उसके कारण that regular inflammation, infections, then they result over long standing time, they convert into cancer. That's the cervical cancer. But there is now a vaccine.
Right.
That is, there were 2 companies, I think, Cervarix and Gardasil, but now only Gardasil is there. Cervarix has stopped. So Gardasil can be given, I said, before the onset of sexual activity, the most ideal time.
But if if someone wants to take after being active?
She can.
She can.
Yeah.
But is it effective enough?
Yes, because it is effective to many other non-cancerous HPV things also, like warts,
Yeah,
genital warts and all. So they are protective towards other HPV infections or presentations.
So there's a very big market hoax right now about intimate care products,
Oh God.
and people are selling it on different names. I am
Okay.
asking, like, if you see there are lightning potions,
Yeah,
and
lightning
serums
and brightening and
brightening.
spreading.
Like India is obsessed
There.
with lightning and bright everywhere.
Acha, haan.
So
What do you want to light over there?
that's
I
the
don't know.
question actually.
Okay.
But is it any like worth it, like?
No. I know.
Straight no.
Yeah.
Straight.
And oh no. Just keep simple cleaning with water. Indian habit of cleaning with water is the best.
How often does testing has to be done regarding any STD or any STIs? Matlab, how
Okay.
often
Yeah,
and type that you face, and then there's a judgment that has been passed when you go. So it's a
Who passes what judgment? If you're worried, then you change your lifestyle. See.
How?
Yeah. See.
that was done.
Yeah, I'm too direct.
Very
So if
valid.
I say that if you're worried about somebody's judgment, you wouldn't have taken the lifestyle. If you have no care, devil care attitude, and you've taken up a kind of lifestyle which you have, then take care of
So
yourself.
I care now.
No. Then take care of yourself. First, love yourself. First, have a protected intercourse. If you have a protected intercourse or barrier contraception, that's where barrier. Now you say this is another kind. Barrier contraception, where there is a female condom, there is a male condom. Okay, so when you are not bothered, when you don't know anything about your sexual partner, or it is like a one day stand. What do you say? One night stand. Okay, such kind of relationships, then you have to take care of yourself.
So how often one should get tested?
See, first thing is, if you have any symptoms, like you said, bacterial symptoms, you will have soreness at the vagina, you may have ulcerations, you may have curdy discharge, itching, absolute foul smelling, you may have fever, you may have weakness, and recurrent falling to infections. So then you should check yourself. Before that, you should check every 6 months, at least you can check. If you're worried, you can check. Because like you had a sexual activity, kal sabere infection hoga, aise kuch nahi hai. Means like you had a sexual intercourse, now you're guilty now, so I'm going to get HIV, so tomorrow morning you do HIV, it's not going to become positive, because HIV and such infections have a 6 to 9 months gap,
Okay.
where they may not be detected.
Often females during their menstrual cycle feel some kind of a lumpy situation nearby the breast or nearby
You said
the
during the
armpit.
menstrual cycle?
Yeah.
Yeah, okay.
So even without it as well, then you do feel now and then a little bit of lump nearby your armpits or maybe your breast. So when it is an alarming situation that you should go and get checked.
If you feel any really lump, then you should go and get yourself examined.
Then I think it is better to go and get yourself
Yeah, from the examine from the
because in
gynaec.
The person might not be able to feel and differentiate.
Exactly. Actually, for breast cancer, they say the first doctor is a woman herself. Because she knows what normality is for her breast.
What was there, what was not.
Yeah, what was there and what was
Also
not.
the size difference, like
That's normal. Some people can have different size breasts.
There's a lot of confusion around
regarding
PCOD,
PCOD and PCOS.
and is there a cure? Is there like a definitive treatment for that?
Like when I started, I am 28 years down the line now in practice. But initially when I started, there's hardly any case. PCOS was just like we read about it, and it's a textbook thing, and we some cases of infertility you could see this must be PCOS because she has irregular cycles. Regularity of cycles were a norm. Now PCOS is not like like a disease. It is something that is changed in the system, our metabolism. It's just like how you say syndrome X or obesity. You say syndrome and metabolic syndrome. See, all these words normal people have googled up. Syndrome X, metabolic syndrome, because everybody is into weight loss. So it's the same thing we can go in PCOS. Now that is because of changed lifestyle. Earlier women used to work very hard, pulling water out of the well, washing the clothes, collecting wood,
Everyday life
burning,
was
everyday
tough.
life was
Everyday
life, tough life, working
Wasn't-
day in and day out.
Not a sedentary life.
Not sedentary, yes. And working the farms, then childbirth, rearing up the children, everything. So now everything is at the tap of a button. पानी
It's all
बोलो,
digital.
मिक्सर बोलो, कुछ भी बोलो,
Yes.
सब कुछ and everything is, अभी उठ के स्विच भी नहीं ऑन करने का, Alexa चालू कर दे, ये करना वो करना. So everything Alexa is doing for you, okay? Otherwise the maid is doing it for you. So now you are having a sedentary lifestyle. That's the only reason. One more great culprit is stress. So we are having a fast-paced life, competitive life. Women want to do as better and as good and better than men.
I guess we've covered almost all the most Googled questions, gynecological questions.
Thank you so
Thank you
much.
so much. Thank you so much for your time.
Yeah, thank you.
Thank you.